Hello and welcome. My name is Dr. Raj Persaud. I'm a consultant psychiatrist based in private practice in Harley Street, London, and I'm delighted to be joined today by the author of a fascinating new book. The title of the book is A Theory of the Aphorism, From Confucius to Twitter, by Andrew Hui. Andrew Hui is Associate Professor of Humanities at Yale-NUS College in Singapore. NUS means the National University of Singapore. He's the author also of a previous book, The Poetics of Ruins in Renaissance Literature. So, Andrew, many thanks for joining us today, and thanks for producing this fascinating book. The reason I'm interested in this book is, and we're going to ask you in a minute to define what an aphorism is, but I think at the heart of your interest in the aphorism is something that psychiatrists and doctors and therapists should be interested in, because basically aphorisms are little pieces of advice. And at the heart of the psychology of the aphorism is a very important idea, which is how to give advice. And I think that you can go to medical school and spend the whole 6 years studying medicine and never actually have a conversation with a senior doctor about how to give advice. And I think your book wonderfully captures the essence of what is a great aphorism, which is basically what is a great piece of advice. So let me start by asking you, what is an aphorism?
Great. Well, first, thank you so much, Raj, for having me. And this is really my first time talking to a psychiatrist. And so I'm really honored, and I'm delighted that you're interested in my work. So to answer your question, I have a relatively simple definition of an aphorism. Simply, it's a short statement that demands some sort of explanation or explication. And so in that sense, it's different than other forms of short sayings like a proverb or an epigram or a maxim.
And in fact, you list in page 4 of the book some of these rival short sayings, an epigram, adage, commonplace, maxim, precept. So a proverb. So tell us again a little bit about the difference between an aphorism and these other examples of short sayings.
Okay, so here are some aphorisms that your listeners might know. For example, Jesus says, "The kingdom of God is within you," right? So that fits my definition of an aphorism as a short saying that requires some sort of interpretation, right? What does it actually mean that the kingdom of God is within you, right? Because there's so many ways that you can interpret that, right? Or, for example, the Greek philosopher Heraclitus, he says, "Nature loves to hide." Or here's one from Pascal: "The eternal silence of these infinite spaces terrifies me." And let's have one more. This is Nietzsche: "If a temple is to be erected, a temple must be destroyed." So these are what I consider to be philosophical aphorisms or philosophical fragments. And they can be contrasted with other forms of the short saying. So for example, like a proverb is something like, "There's no place like home," right? And what's interesting about a proverb is that they're kind of commonplaces, right? They're anonymous, they're kind of folk wisdoms. And so what I've discovered in my study is that for every proverb, there's actually an equal and opposite proverb, right? So this is kind of like the Newtonian laws of physics. Out of sight, out of mind, absence makes the heart grow fonder, right? So what an epigram is something that's clever, and it's something that has a sarcastic twist, right? So Oscar Wilde is a master of that. And but here's one I like to share with you from Martial, the ancient Roman poet. He says, "A work isn't long if you can't take anything out of it, but you, my friend, even write a couplet too long," right? So the wit is at the end there, right? And so a maxim is simply like a pithy bit of moral instruction. And so something, the Greek maxim is "nothing in excess," or "know thyself," right? Yeah.
So an aphorism is an interesting thing to me in terms of giving advice, because it also has to stop and make you think. I think elsewhere in your book, you say one of the definitions of an aphorism is something you've got to read twice. So there's something interesting about the idea that it challenges you. So tell us a bit about that aspect of an aphorism.
Yeah, so in that sense, I mean, you were talking about how, one of the impenetrable mysteries of the medical profession is how to dispense advice, right? Now, advice that is a verbal one is different than a medicine that you take physically, right? Because the patient receives the medicine and it does the work for you within your body. There's nothing that the patient really has to do, right? Except what you might want to think about as an aphorism is a doctor's prescription for exercise, right? Not to exercise, not physical exercise, right? Not doing stretches or, lifting weights or cardio or so forth, but mental exercises, right? It's, I guess, for me, coming from a point of view of pedagogy, right, since I am a professor and since I teach undergraduates, it's there's always a slippage between teaching and learning, right? And so where is the transference of that? And I think where the transitive property of the aphorism is that, in a way, it's a dialogue between the author who wrote or composed the aphorism and the reader, right? And the vehicle, right, of this transfer is the aphorism. But because the aphorism is enigmatic and mysterious by nature, right? Because I think what the aphorist wants the reader to do is not precisely to follow 100% their prescription or dogma or doctrine, but for the reader himself to develop his own philosophy of life, right? And so that becomes a participatory or engaged way of learning, or in which reading an aphorism becomes a way towards the art of living.
So an aphorism, I think, from your book, challenges you. It kind of like
Exactly.
you've got to read it twice because you don't really understand it the first time round.
Yep.
It might be slightly shocking and it might be slightly disturbing. And I think at the heart of psychiatry and medicine, we've lost the art of doing that. We've come to a world where we have to give advice that is self-evidently true to the patient.
Right.
And the patient gets annoyed if you say something that doesn't quite make sense. And I think we could liberate the therapeutic conversation a little bit if the patient understands that part of the real job of the therapist is to say something that makes you do intellectual work or emotional work or cognitive work. Any thoughts about that point?
So Raj, let me ask you this, and we'll turn it into a real dialogue. What were some pieces of advice that you've dispensed in the past week to your patients?
Well, I'm glad you asked me that, because I'm proud of the fact that I think I've developed a couple of aphorisms. I'm a bit nervous about sharing them with you because
please do.
Because you're the world expert on aphorisms. So in private practice, you often deal with people who have money, and they sometimes fail to see sometimes that money can be a prison, or money can create problems in itself. So I've developed a saying to try, and often people with money develop psychiatric problems to do with excess. So they drink too much, or they eat too much, or they take too many drugs, or they lead a life too full of luxury, which creates problems.
The means of doing so. Right.
Yeah. But now, so I have an aphorism. Maybe someone's going to now write in and say, well, that was someone else's. But I honestly believe I've developed this. I say deprivation creates luxury. Now, what I mean by that is that if you fly by private jet all the time, after a while, it's no longer luxurious. Yeah. It's if you've been on a desert island for 7 days and not had a drink of beer, and then you get rescued, your first glass of beer is an experience of luxury because you've had deprivation before. In other words, you can only experience luxury in the presence of deprivation previously. If you've always had luxury, it stops being luxury. So deprivation creates luxury is my stab at an aphorism. I don't know what your reaction is to that.
No, I love that, and it makes perfect sense to me, and I think that's a really good philosophy of living. So I guess, to continue with this conversation is, so this can apply to a multitude of people in a particular social economic class, right? And so you as a psychiatrist, is there a typology of patient, or is every patient unique in their own individual problems? You see the point I'm trying to get across is how universal is an aphorism, right? And I think what's interesting about aphorisms is that it really hovers between the utterly unique, the utterly individual, the utterly singular, versus the more general, universal, global.
Well, I think at the heart of what I'm getting at in terms of why I think aphorisms are so interesting is the classic problem that most psychiatrists and doctors encounter with a particular kind of patient is the patient who resists. So that,
Right.
for example, the patient who is being emotionally or physically abused by their husband or wife, or let's more often than not, it's a male-female dynamic, and
Mm.
refuses to leave the relationship. When it's blindingly obvious, that's what they should do. So they
Yeah.
stay, they're upset, but they won't leave. And I think
Mm.
that that encounter of resistance, the aphorism at that moment is the best
Mhm.
chance you've got to get them to think
Mm.
something through. And I think the
Mm.
therapeutic work of the
Yeah.
therapist is to create an aphorism at that moment
Mm.
that helps break through the resistance or helps the patient do the work to
Yeah.
break through the resistance.
So, how did your patient react to your uh, aphoristic advice?
Well, that's, I mean, sometimes they get it. Again, there's a branch of psychotherapy which talks about the paradox, which is you prescribe the symptom, you do something paradoxical. So
Right.
a patient comes in and says, I'm worried, I'm really worried about something, and
Hmm.
they're staying up all night worrying about something. And a great psychiatrist who was my mentor, who sadly died last year, Peter Bruggen,
Mm.
a famous child and adolescent psychiatrist, and I have many aphorisms I've stolen from him. He would
Mm.
say something to the patient, which would be along the lines of it feels to me that you think worry is doing something, is achieving something because you're doing so much of it. Maybe you should worry some more.
Mm.
And that is an aphoristic stab at engaging
Yeah.
with the patient and trying to
Yeah.
get them to see
Right.
something, which is they're doing something maladaptive. And again, that's at the
Mm.
heart of psychiatry.
Yeah.
Now,
Yeah, and it seems like, I mean, for me, a mark of a good psychiatrist is discerning the character of a patient's soul so that the doctor knows what aphorisms to dispense and what aphorisms not to dispense, right?
yes,
And
yes.
what's interesting when you're talking about, uh, the work of therapy, right? It happens not only within the session itself, right? This enclosed, circumscribed space, but it's supposed to kind of it's supposed to pervade your entire living existence, right? So you have to somehow give your patients some homework, right? They're supposed to chew on this aphorism, for the next week or so. And so in a way, like you're kind of like a Zen master, right? Giving the monk or the student a koan, right, in which he has to solve.
Exactly. And that's where I think psychiatry and psychology can learn a lot from your book on about aphorisms, because we tend to give advice that doesn't lead to the patient thinking about it for the next week. And that's what
Right.
we need to do. You're precisely right. The session is just part of the treatment. By a long stretch, the biggest part of the treatment is what happens between sessions. And what we're hoping
Mm.
is that the patient's going to be doing some work, intellectual work, cognitive work, or emotional
That's the
work.
homework. Yeah, it's the
Yeah.
homework.
Yes,
Right.
and the aphorisms got the best chance of making that happen, in my
Yeah.
opinion, rather than straightforward advice.
Right, because I think straightforward advice, there's resistance because it's the resistance of any schoolboy or schoolgirl in the sense there's this resistance toward pedagogy because teaching becomes too didactic, right? It's too much hierarchical, right? It's too much of a passive route memorization, as it were, right? Whereas I think the aphorism, it's short, it's brief, it's memorable, right? But it punctures. It's like this insect bite, right? That you have to scratch, right? Because it either annoys you or it fascinates you or it rubs you the wrong way, right? And so that scratching itself is the work of the soul, right? Towards healing, paradoxically, right? It's the activity of the intellect in arriving at some truth.
Yes, and I think that the aphorism inspires as well, and excites and puzzles and annoys. So
And I think it
it creates
also
an emotion.
transforms, right? It also transforms and transfigures, right? Which is
Exactly.
why
Yes.
so many great religious figures, right, religious philosophical figures, whether it be Confucius or Jesus or the Buddha or Zarathustra, right, or Nietzsche, right, deploy the very form of the aphorism because the most advanced intellect could get it as well as the old lady on the street.
Yeah, so let's go back to your book in terms of where aphorisms begin. And again, something very relevant to doctors is it seems to begin with Hippocrates. Could you tell
Yeah,
us a bit about
absolutely.
that?
Sure. If you don't mind, I'll just read one paragraph from the book because it's where I discuss the origins of the word aphorismos. So the word aphorism is composed of two Greek words, apo, which is from or away from, and oritsen, or to bound, right? So it's a horizon. And what's interesting is that you can't ever arrive at the horizon, just like you can never really penetrate into the heart of an aphorism. It is both infinitely receding, it's imminent um, and eminent, right? So it's ever transcendent. It's a line that is without beginning or end, cutting the visible and invisible. But in any case, the word aphorismos comes from Hippocrates and his collection of aphorisms on medicine. And the first aphorism, which the collection opens with, is a very famous one. Life is short, science is long. Opportunity is elusive. Experiment is dangerous. Judgment is difficult. It is not enough for the physician to do what is necessary, but the patient and the attendants must do their part as well, and circumstances must be favorable. So there you have it there, right? So Hippocrates agrees with you, right? Physician can only go halfway, right? The patient must do their part as well, right? Um, so I think what's interesting in this set of Hippocratic aphorisms is he's praising human science, right? He's praising the work of medicine in opposition to the transience or the contingency of human life. But what's interesting is that he also undercuts it, right? He says it's really hard to provide the opportune or the correct diagnosis, much less prognosis, because situations are always changing, right?
Yeah, and there's a follow-up aphorism in the next page from Galen,
Mm,
another very eminent physician.
yeah,
The power of exegesis is to make clear everything that is unclear, writes
right.
Galen in his commentary on Hippocrates. So it's fascinating to me that these early doctors are using aphorisms straight away, and that aphorisms,
Mm,
in a way, come from medicine.
yeah, and I mean, what's interesting as well is that you were talking about how you yourself, through your experience, authored these aphorisms, right? So you're the authority that dispenses these aphorisms. But so your authority is unique in the sense that you have a one-to-one, unique, unreplicable relationship to your patient. But what's also interesting is that you yourself are a transmitter of this vast repository, vast body of knowledge from your profession, right? Because you are a inducted member of this guild, right? So an aphorism is something that is at once utterly unique and also utterly traditional, right? In the sense that it could be passed down from person to person, right? And um, so, I mean, I suppose the um, presupposition of any scientific inquiry is that there must be some sort of stable correlation or correspondence between theory and observation, right? So, in order for you to diagnose a disease, a doctor must believe that phenomena are somehow repeatable, predictable, and ultimately rational, right? And so, the question that comes down to it is, or how repeatable, how predictable, how rational are our psyches, are the operations of our minds and our bodies.
And that's again another reason why I think aphorisms should be of interest to psychiatrists and psychologists and doctors, because you're arguing in your book that the aphorism is against system, as I understand it.
Right.
That it stands against system. Could you
Mm.
say something about that?
Yeah, I mean, I was really thinking of systems in the philosophical sense, right? Of these that pervades all of basically the history of Western philosophy, from Plato to Aristotle to Descartes to Kant and Hegel, right? And part of the argument that my book is making is that aphorisms always are in this dialectical opposition to these statements, to these systems, in the sense that aphorisms come either before, against, or after philosophy, right? So you can see how the early Greek philosophers like Parmenides or Heraclitus, the masters of the aphoristic form, really came before and anticipated the grand philosophical systems of Plato and Aristotle. And you look at the beginning of early modern philosophy, the fragments of Pascal comes after the clear delineated systems and definitions of Descartes. And finally, towards the end of one branch of Western philosophy, at least, Nietzsche, right? He's writing his aphorisms and fragments and notes and maxims in opposition, right, to the grand narratives of Kant and Hegel, right? He recognizes the collapse of German idealism, and so what he's trying to do is gather the shards, right, in order to create something new. And so, in that sense, I think the aphorism really is a much more personal way of doing philosophy, right? In that it engages with the individual disciple or reader, right? And so, when you read an aphorism, Pascal or Nietzsche they don't particularly want you to become Pascalian or Nietzschean, right? They want you to create your own philosophy of life. They want you to create your own doctrines, rather than a philosophical system as something that is regurgitated or transmitted passively.
And I think that fits very well with a problem at the heart of psychiatry and psychology and medicine, was when you get stuck with a particular patient and the patient is resistant, and the system that you brought, the Freudian theory or the cognitive behavioral theory, it doesn't work because the patient's resisting, and the system now collides with the particular individual patient in front of you. And I think doctors get frustrated at that moment, and what the aphorism helps them to do is to liberate themselves from the idea that they're going to get stuck within a system and just confront that particular patient with that particular resistance. And I think the aphorism helps them break free from the system of thought, which would work with some patients, but doesn't work with everyone.
Well, Raj, let me ask you this. What is the end of analysis? Is it really... How do psychiatrists think about the purpose of analysis? Is it interminable, as Freud says, or at what point does a patient achieve closure, or does the patient achieve this state of health?
Well, that's a very difficult question to answer succinctly. But basically, if you have a medical model of psychiatry, which is that you believe depression, people get depressed a bit like they get the flu, maybe a bad analogy, or they get a serious pneumonia. The end point of the treatment of a pneumonia is you give the patient an antibiotic and they are not hampered by their symptoms anymore and they're able to go back to work. If you get hit by clinical depression, your wife leaves you, or you get sacked from your job and you become clinically depressed, you can receive treatment from a psychiatrist, and after you've improved your mood and you're able to go back to work or go out and date again, then that would be the end point of treatment. The Freudians had a view that was too simplistic a model. They didn't think that psychiatric disorder arose out of simply life events. They thought it arose out of something much deeper, which is aspects of your character and personality, which was a much bigger, longer-term project to work on. That's why, for the Freudians, it was a journey without end, to some extent. But the modern world, where people haven't got the kind of money and time that middle-class Viennese people had, has constrained treatment to an idea to be more goal-oriented, which is what's the goal, and let's try to reach an endpoint. Now, that takes us on to the arc of your book is to start with the ancient Greeks, and you end with Twitter and the modern world, the modern world's way of dealing Twitter, it seems to me, what's very interesting about your book, represents an opportunity for us to say something profound. People look down on Twitter because they say it's just a short sentence or short number of sentences. Therefore, by definition, it can't be profound. And you're kind of saying, well, hang on a second. If we look at aphorisms, Twitter could be full of really profound things. It's just unfortunate it doesn't seem to be. Twitter represents a lost opportunity only if you understand the power of the aphorism. Could you say something about that?
I mean, I just want to respond very quickly to the Freudian model that you talked about, and you were positing that for the Freudians, they saw analysis not only as situational, right, not just as circumstantial, right, but something that is deeper and underlying, which is to deal with the flaws in our characters. And I mean, in fact, that is a very Heraclitean pre-Socratic view of the nature of man, right? I mean, Heraclitus has this great aphorism that says character is fate, right? And in a way, all of our ways of doing the art of philosophy, the art of philosophizing and thinking through aphorisms is nothing but to understand truly and deeply, the nature of the self, right? And aphorisms, Twitter included, are different ways in which we can decipher the enigma of the self. Now, let's get back to your question of Twitter. Yeah, so I'm interested in Twitter not because there are lots of great aphorists who are pontificating on the platform every day. No doubt there are. I just haven't discovered any. But I'm interested in Twitter as a platform for communication, right? And I'm interested in its communicative possibilities and how tweets can come before, after, and against the systems of long form publications. And I'm just interested in the ecology of the Twittersphere in the sense that you can follow people, people can follow you, you can retweet, you can offer comments, you can like or dislike or unlike, right? And so what's also interesting about Twitter today is how this type of transmission and communication is instantaneous and it's non-hierarchical, right? Everybody can sign up, everybody can say whatever they want on Twitter, and with enough followers and friends and retweets, right, you yourself can be a foremost aphorist.
But people tend not to be. That's what's so interesting. People tend to think the short form means they can't really do anything profound. It seems to lead people in a different direction.
Yeah, that's right.
Say unprofound things.
Yeah, so I mean, so in that sense, the aphorism is very timely, right? Because we're inundated today with tweets and memes and GIFs, right? We're living in an age of distraction. So aphorism seems to be the perfect genre for today, but it's also quite ill-matched to this cultural climate, because what it asks us to do is really suspend or demand for instant gratification, right? And so I think the aphorism today cuts both ways, right? It's quick and easy to read, and it's instantaneous, but because of its hermeneutic density, as it were, right, it can paralyze us as well as freeze us.
Yeah, so let's go back to the book as well. And you talked a little bit about an analogy between an aphorism and a hedgehog right back at the beginning of the book. Let's go back to that bit. Tell us a bit about that.
Sure. Let me just look for that page. Okay. So I begin the book by invoking this German Romantic philosopher, Friedrich Schlegel. He has this rather elegant definition of a aphorism, which says, a fragment ought to be entirely isolated from the surrounding world, like a little work of art, and complete in itself, like a hedgehog. Right? And so, what do you think about this interesting, enigmatic?
Well, it takes us back to Twitter, which is that Twitter seems to be very much of the world. People are tweeting away and there's a sense in which nothing else seems to be happening other than their description of everyday activities. It's very mundane. And your quote, Schlegel, is saying the aphorism should take us out of the world, out of the mundane, and and take us somewhere else. And it should be separate from the world. And we should separate ourselves a little bit from the world. So again, the arc of your book takes us to the fact that Twitter seems to represent a lost opportunity, but you can only understand that if you understand the psychology of the aphorism.
Right. Well, I mean, I think it also encapsulates, the paradox of our lives today, in which, we have two selves. We have a digital self and we have an analog self. Right. And so what are the permeable boundaries between the two? Right. So when Schlegel says a fragment ought to be entirely isolated from the surrounding world, what he also means is that it has to be isolated from it because it encapsulates it. It's a repository of the world that gives birth to it. Right. But like any work of art, it has to be at some sort of critical distance, as we severed from the world, for art to achieve any sort of autonomy, right? And so it's precisely in this act of rupture that the fragment comes into being, right? And so here again, we're confronted with this profound dialectic between the fragment and the system.
But I'm running out of time a little bit. Let's go back to the end philosopher you end with, which is Nietzsche. One of the things that makes Nietzsche very difficult to read is his aphoristic style. Yeah. And one aphorism followed by another, followed by another, followed by another becomes a bit impossible for people to read. So there's a sense in which you got to be careful with aphorisms. If you do too many of them, you kind of lose the point of them. And
you get kind of constipated, right? Or you lose a thread.
Yeah. Now, Nietzsche is very important because a lot of people don't realize that Freud was very influenced by Nietzsche. And I think Freud said, and I'm a bit worried I may have got the quote wrong, but Freud said something along the lines he had to stop reading Nietzsche because if he carried on reading him, there would be nothing left to say. And so Nietzsche is the one who suggests that things are not what they seem, that when you perform an act of charity, it's not quite that you're being a great person. There's something else darker going on. So Freud actually borrows this idea that appearance hides the unconscious or hides deeper possible motivations. So what about this problem that Nietzsche does too much aphorism? Would you accept that point, or what's your reaction to that?
Yes and no. I mean, in a way, Nietzsche ultimately also wants us to stop reading him. I think ultimately what he wants us to do is stop reading the aphorisms of our predecessors, stop listening to the advice of our psychiatrists or our professors or our doctors or any professionals, and really take up and be the masters of your own fate, right? Be the author of your own life, craft your own life philosophy, right? And so one of my favorite aphorisms of Nietzsche is he says in The Gay Science, "What good is a book that does not even carry us beyond über all books," right? And so there is a sense in which we can get too inundated with, the social media of our lives, with these constant updates. On the one hand, we have that. On the other hand, we're inundated with all the fragments, all the stuff that antiquity and our parents and our forefathers and our ancestors left us, right? And so in that sense, it can be quite asphyxiating, right? It can be quite exhausting and suffocating, right? To plow over, these well-read texts. And so there is a sense in which you have to, at the end of the day, you have to stop reading aphorisms and create your own aphorisms and live out these aphorisms.
So to conclude, what are your thoughts about the notion I've been trying to bring to the table, which is the aphorism as therapy, the aphorism as advice, the aphorism as something that you take like a treatment and helps you be a better person. It helps cure you. It helps you be better. What about that idea?
I like that idea a lot. I mean, one of the great influences of my book is Michel Foucault, right? So Michel Foucault, towards the end of his life, he wrote this series of books on the histories of sexuality, and one of the volumes is called "The Care of the Self," right? And he talks precisely about how the ancient way of doing philosophy is you read notes, you read some maxims and aphorisms of the philosophers, and every day you reflect it on a little bit and you write commentaries on it, but you also write your own aphorisms, right? And so in that sense, aphorisms are this dialogue you have with a certain set of received wisdom in which you are free ultimately to either absorb it into your own life or reject it and come up with your own philosophies.
But I also think one of the really challenging and provocative things at the heart of your book is it's an anti-book book, because that's what aphorisms are. They're about an idea, which is the ideas, which are the important things, can be captured in an aphorism. And the idea that we can communicate, the academic world, everyone's got to go and write a book, and you've got to read a book to be taking part in serious intellectual pursuits. The aphorism stands against that and says that actually in having to read a whole book or to write a whole book, you end up getting distracted away from the kernel of the key idea, which is captured in an aphorism. So the psychology or the philosophy of the aphorism is an anti-book idea.
Yes, right. It's anti-book if you take the book as a system of thoughts and arguments and logical discourse. So absolutely, I agree with that. But then, paradoxically, how so much aphorisms survive and are transmitted throughout the classical and modern traditions is through the form of the book, right? So at the end of the day, you're still stuck with the book.
If we come to the notion that part of the job of therapy is for therapists to create aphorisms that engage the patient, which we're giving them work to do, which they might reject or feel is a step too far. What are your thoughts about that? And you having written this book, do you find yourself creating aphorisms? How has the book changed you?
That's a terrific question. I might not have achieved a sufficient level of self-analysis or distant from the book to see how it's changed me. Well, I mean, I can say, just very simply and biographically that I wrote this book when my wife was pregnant with our first child. So I had basically 9 months to do it because, I knew that when the baby came, it'd just be havoc in the house. And so I had to write very quickly and I had to write, fast. And so this is how I kind of came up, with this kind of panoply of authors. But I think maybe at the end of the day, self-mastery means that you no longer need the authority of a doctor or a teacher or a professor, right? You yourself become your own master. You yourself become, it's doctor heal thyself, right? And so perhaps what aphorisms ultimately do is destabilize this relationship between doctor and patient, in which the patient is no longer in the passive receiving end of treatment, but through his or her self-mastery, right, is able to be critical and resourceful enough for self-therapy and self-care, right? Hence Foucault's notion of therapy of the self, or care of the self.
Well, that would be a great place to end, except I'm afraid there's just one final question I want to ask.
Yes,
which is that why has the aphorism been neglected? Your book stands relatively isolated, a bit like aphorisms are, in terms of an attempt to study them in depth. Why has it been something that hasn't interested academia so much?
That's a great question, but lucky for me, right? Because if it was really if it's interested lots of people, then I wouldn't have had the space or the clearing to write this book, right? There have been multitude of books written on the histories and theories of drama, poetry, the novel, theater, right? But yeah, I mean, you're right that mine is kind of one of the only succinct theories out there. So I don't know, but I'm glad. I'm glad I was able to write this book precisely because other people weren't interested in it.
Well, Andrew Hui, thank you very much indeed for talking to us today. The title of the book is A Theory of the Aphorism, From Confucius to Twitter. It's published by Princeton University Press. Thank you very much indeed.
Thank you so much. It's been a real pleasure.